Ashley and Susie, I appreciate you being here so much today to work on this simulation scenario about accessing a port for an oncology patient. Before we begin, I just want to remind you of a few things. The scenario will take about 10 minutes for each of you to do. And while Chester Chest is not a real patient, I've provided some details about your patient, JG, based on information from real patients that we see on 4Oncology. As you know from reviewing the ASCO article before this simulation, proper central line care and maintenance is one of the most important things that you can do for the oncology patient to prevent infection. I'm asking that you work on Chester as if he was a real patient in a real patient scenario. I'll give you each of you a checklist, and I'd like you to take turns accessing Chester's port as if you were a preceptor, discussing aloud to your colleague and the patient the steps that you are doing and why. Your colleague will have a checkoff sheet that comes from the UNC CVAD policy 0074 and will be observing you to ensure that all of the steps in the procedure of CVAD access and dressing change are done. After both of you have had a chance to do the skill, that is be the preceptor and be the person doing the checkoff, we'll discuss the scenario. While there's no grading for this scenario, I want this to be an opportunity for you to demonstrate both your skills in accessing a central line and your knowledge about caring for neutropenic thrombocytopenic patients in a safe space. Do you have any questions for me before we start?
No, ma'am.
Okay. Well, let me tell you a little bit about JG then, and I'll leave this here for you so that you can remember. JG is a 21-year-old college student who lives with his parents and is on a leave of absence from school. He was diagnosed with ALL 2 months ago. He's had his induction and he's here for consolidation chemotherapy. His white cells are 0.8, ANC is 0.4, hemoglobin and hematocrit are 11 and 27.2. His platelets are 15. His vital signs are stable and he has no signs and symptoms of infection. So Ashley, if you begin, you should have all of the supplies you need, talking to us about how you would access his central line.
If you want to grab
Some hand sanitizer, that's a great idea. Thanks, Susie, for pointing that out. So
I'd
we'll
like to
be
point
able
out
to.
that if we want to prevent infection, one of the biggest things we do is wash our hands.
That is a great point. Thanks.
Wash your hands. Good afternoon, Mr. JG. I'm Ashley and I'm your nurse, and you're here for consolidation treatment, and I'm going to get started with accessing your port. I'm going to just finish washing my hands, and before I actually access the port, I just want to feel to make sure I know where your port is located. Okay. Fill that there. And then we're going to open up the supplies we need. Put my mask on, and then there's a mask too that I'll give you. And the reason why I'm putting this mask on is because you're neutropenic. So your white count 0.8, but your neutrophil count is 0.4. So that puts you at increased risk. And so I think it's important for you to be protected as well as me. Okay, now we're going to open up some other items we have here. We have some saline. Here goes the end of the needle. Bio patch that reduces the risk of infection to the site. We actually have Did your parents come along with you today, or are you just here by yourself? You're by yourself? Okay. Must be coming a little bit later on then. started this. Almost done. Put in the cap here. And, now I'm just going to clean it here with some alcohol. Okay. Now, I'm ready to access your port. Feel me come over here. To take really a deep breath in and a deep breath out. 1, 2, 3. All right, feel blood return. How do you feel?
I feel fine, thank you. Hardly felt it.
That's how I like to do it. So lay this here on your chest. You said you're not allergic to this type of dressing, so. I'll put the date and time here for you, when this was last changed. Date and time. Okay, I think we're all set. Get that chemo started for you.
That's great, thank you, Ashley. So at this point, if you wanna get your mask off, we'll have you guys switch spots. Susie will take a turn. She can actually act as though the patient is already accessed and remove his dressing and then do a re-access on that, once a week schedule. I'll move out of your way. And then we'll talk a little bit about what Susie observed for Ashley, what Ashley observed for Susie, and what you've learned from doing this process.
Go ahead and gather my supplies.
Thank you.
I'll take my sterile saline, my needle, my guide patch, and my cap for the end of the needle. So, Mr. JG, see you're back in the hospital. I'm chatting with you